Welcome to the Edgewater Healthcare Podcast. Our goal is to inform you about the international nurse recruiting industry via candidate interviews and bite-sized episodes. Let's get started. Welcome back to another episode of the Edgewater Healthcare Podcast. Today we are thrilled to introduce Tony Diamante, the COO of Edgewater Healthcare Services. Tony, how you doing today?
Great, thanks. Appreciate you being here.
Awesome. So let's dive right in. So Tony, you and your company are in the midst of the most challenging time in healthcare. Yet your company has emerged as a credible solution to the specific challenge that hospital and health systems are facing, such as staffing shortages, in particular nursing shortages. So tell me, what drives your fundamental mission to be a credible solution?
As our CEO Johnson Chin stated in a previous podcast, we strive to be an ethical company advocating for nurses in their journey to come to the U.S. We want both nurses and clients to know Edgewater Healthcare Services is not just a company assisting with a task, but a partner ensuring the goals of each party are met. I've always been a service-driven person, attending to the needs of others to the best of my ability. This was a natural fit for me.
Okay, great. Talk to me about your role. What do you do on a daily basis to be effective in your role in an international recruitment company like Edgewater?
There are many tasks involved and parties to coordinate: recruiters, hospital clients, immigration attorneys, and the nurse applicants. By far the most important role I have is communicating the nurse criteria for hiring and scheduling interviews, educating nurses on the immigration process, walking the nurses through the immigration process, making sure the nurses are prepared to work in the U.S. So I'm consistently emailing, Skyping, or ensuring the correct information is transmitted in a timely and effective manner. Always knowing the next steps and what to expect are vital. We also assist the nurses with the financial aspects of immigration, such as attorney and filing fees. It's also important to paint a clear picture for the nurses so their expectations are met and defined. There have been recent challenges due to the pandemic, but being in constant communication helps all parties to understand what next steps always are. Of course, spreadsheets and reports help.
Tell me about the clinical prowess and competencies nurses from the Philippines face. I had a chance to interview the first 4 arrivals. I must say, they are well-spoken, confident in their clinical skills, and excited to be in the U.S.
Well, Filipino nurses are known the world over as being the best in their field. All Filipinos are taught English from kindergarten. Their schooling and training is in English. They are all well versed in the clinical skills required for the job. Many work overseas in hospital systems very similar to the U.S. Most important, they're able to communicate effectively and clearly, which is a crucial skill in the medical field.
How are the nurses who have arrived received by their employer? Are their expectations well aligned?
They have been received very well. The nurses have indicated to me they feel accepted and part of the team very quickly. The hospital has told us they are very happy with both the nurses' skills and how well they fit into the company culture and environment. Both parties are very happy and excited for what's to come.
You have now earned a reputation for being credible in your recruitment and selection process. We heard from the nurses who recently arrived incredible testimonies about Edgewater, Johnson Chin, and you. Tell me, how do you plan to maintain and sustain such excellence?
We will continue to live by our mission and goals of high ethical standards, nurse advocacy, and client satisfaction. As long as we continue to focus on these 3 goals, we will always maintain and improve our processes and standards as best we can. We hope you enjoyed today's episode. Please like and follow us on your favorite podcast platform.
And feel free to contact us at 888-375-9749. Until next time, and remember, we work for you.